Good afternoon, everyone. We're going to talk to you today about healthcare laundering and the research that we conducted during the pandemic. So today we're going to do a bit of a lecture and then a sort of question and answer discussion session at the end, just so we're not all just sitting and listening, because that's what we've been doing most of the day. So I'm Professor Katie Laird. I'm a microbiologist, and I specialise in healthcare textiles and the infection control risks from them. And I've been working with the global laundry industry as well as NHS Trust for many years now. So I'm just going to introduce you to the rest of the multidisciplinary team that we had working on this project.
I'm a virologist and lecturer at Montfort University and work with Katie on sort of developing the virus model that we used.
Hi, I'm Lindsay Apps. I'm a senior lecturer at DMU in psychology, so I'm a practitioner health psychologist by background.
Hi, I'm Lucy Owen. I'm a research fellow specialising in microbiology, and I sort of performed the lab work involved in this study. So I'm going to talk to you a little bit about that later.
So just to give you some background, at the beginning of the pandemic, I was contacted by a nurse. They just phoned me completely out of the blue and said, I'm really worried. We're being told to take our uniforms home in plastic bags. We don't know what the contamination risk is, and can you help us? So I had that phone call one day, and then about 2 days later, I got a phone call from one of the industrial laundries saying, Katie, we've just got our first load of sheets that have come from patients who've had coronavirus. What do we do with them? I said, what's the advice from the NHS? They said, there isn't. They're just saying to carry on as normal. We don't know what to do. And at this point, I had to say, we've checked the literature, and actually, we don't know what to do. There wasn't the information out there, as there was many of the case with when the pandemic started. So we worked with the global laundry industry. So that was the US, Europe, Belgium, they sit out of the European one a bit, the UK, to work with them to try and understand what to do with textiles and what the transmission risk was. We have a good understanding now, but 2 years ago, we just didn't know. And the other thing, the industry were looking to move to a 90-degree wash, which had significant financial and economic impacts as well, and they wanted to avoid that if they could. So we needed to look into this quite quickly, and there just wasn't anything published, and there wasn't any guidance. And we actually quite rapidly published this paper here, which was the role of textiles in healthcare environments, and what the infection control risks were, just looking at other virus models. And again, there was very limited knowledge. So I'm going to hand over to my tray now.
Thanks, Katie. So I'm just going to very briefly give you an introduction to the virus model that we used. I mean, I don't really need to give you an introduction to the disease itself, but more than 500 million cases of COVID-19 now worldwide. It's caused by the SARS-CoV-2 virus. You can see an image of that over there. And we know, we've heard a lot in the talks today, that it's predominantly, now we know, spread via aerosols and respiratory droplets. But what we were interested in when we started this work was to really understand what the role of this fomite transmission was, particularly on textiles, because that was something that wasn't really looked at, as Katie said. So to do this work in our lab, we kind of had to come up with a model, because SARS-CoV-2 is a biosafety level 3 pathogen, inaccessible labs. Just to make this work a little bit easier to do in our labs, we actually used a seasonal human coronavirus called OC43, which is one of the 4 coronaviruses that cause common colds. So essentially, the 4 coronaviruses listed here, they cause about 20% of the common colds, and all the coronaviruses have a very similar structure. So they have the genome on the inside, surrounded by a lipid bilayer with the spike protein sticking out from the surface. So structurally, they are very similar, OC43, like SARS-CoV-2, is also a beta coronavirus, so it's in the same subfamily of coronaviruses. And we were hoping that this would provide us with a good model to sort of model what's happening with SARS-CoV-2. So the first step was really to establish what was OC43 doing. Is it actually a good model? So to look at that, we first just looked at the stability of OC43, our human coronavirus model, on plastic. So on the top right corner, you'll see sort of the setup that we used, essentially a plastic swatch in a Petri dish, add some virus on it, and then at various times recover the virus and see how much we have there. And we quantified the virus. You can see here this graph showing you the decay of infectivity. So up to about 6 hours, we do see that the virus remained stable on the surface, but after that it sort of rapidly declined, and by 48 hours it was below our detection limit. And when we compared that with what was published in the literature with SARS-CoV-2, the graph on the right shows you in red SARS-CoV-2 and in blue SARS-CoV-1. The rate of decay was actually very similar. So we could see that, yes, this is potentially a good model to use. We know the structure is similar. We know that the rate of decay is similar on plastic surfaces. So we went ahead with sort of using this. So just to summarize this bit, we found that OC43, our model, is stable on plastic for about 24 hours, high stability for about 6 hours, but does decay after. And it's similar in how it degrades on plastic to SARS-CoV-2. And we then sort of thought we could use this model to look at other surfaces and other environmental systems. And I will hand over to Lucy to talk about some of the results that we got with our next bit of work.
Thank you, Maitreyi. Okay, so yes, I'm going to talk to you a little bit about our research that we actually looked at the stability of the model coronavirus on textiles and also during laundering. So as Katie mentioned, this is something that just wasn't really well understood at the start of the pandemic. No one had really studied how it survives on textiles, but more importantly, how it survives during laundering. This wasn't something that had been researched. So this is what we're really interested in terms of infection control guidelines for this. So what we did was we first looked at the stability of the coronavirus on textiles. And to do this, we got 3 different types of textiles. So we looked at cotton, polycotton and polyester, so some really common medical healthcare textiles. And we measured the infectivity of the virus over time. So this gives us an idea of how long the virus is remaining infectious on the surface of the textiles, and therefore if it's a potential risk for fomite transmission. But another part of the potential for it to cause fomite transmission is, does it actually transfer onto other surfaces? So it might survive on the textile, but does it actually transfer to other surfaces and cause an onward risk of infection? So what we did was we looked at the ability of the virus after it survived to transfer onto plastic and other textile surfaces. So these are the results of the stability of the virus on the textile over time. So this graph measures the viral infectivity, and you can see on the graph on the left, you've got the stability of polyester in blue and cotton in green, and you can see that there's a sharp decline in viral infectivity over the first 8 hours. With cotton, it remains infectious for 24 hours, and with polyester, it was actually remaining for over 72 hours. The graph on the right shows polycotton, and we could only detect this for 6 hours, but just to note with this, this is mainly due to limitations with our model. The polycotton itself was actually cytotoxic to our cells that we used to measure infectivity. So we couldn't detect it past 6 hours, but it had a similar rate of decay to the cotton, so we believe it probably survives for a similar amount of time as the cotton. So we showed that it did actually remain stable for several hours on textiles, so it could be a potential risk of transmission. But what about transfer onto other surfaces? Well, we actually found that over time, cotton and polycotton, there was no transfer detected from these textiles onto other surfaces. But when we looked at polyester, there was detected transfer up to 72 hours after it was inoculated onto the textiles. So you can see the graph here in blue. This is the amount of virus that we put onto the donor textile, and the orange and green are the recipient, the PVC plastic and the polyester textile. And we were actually detecting up to 72 hours. You can see on the end there's some virus being detected there. So this really highlights the importance of infection control when handling potentially contaminated textiles. So moving on to laundering. We looked at the stability of the virus on cotton over a range of wash cycles. We really wanted to capture both the domestic and also the industrial type laundering system. So we looked at an industrial wash cycle. So this was a thermal, 67 degrees. An on-premises laundering, so this is more like care homes, for example. They use, again, a 75 degrees. And we also looked at an OTEX ozone wash system. So this is a bespoke ozone wash system that is mainly used in things like care homes, and that's a 40-degree wash. So we tested a broad range of wash cycles. And we looked at the virus when it's applied to the textiles, both in cell culture media, so this is very much related to like what we use in the lab, but we also wanted to mimic the real life conditions. So we used artificial saliva. So if you would, in a normal circumstance, the virus would transfer on saliva, so we wanted to mimic that, and we used that as an interfering substance in our wash tests. So looking at the persistence of the virus on textiles during laundering, we actually found that when you looked in cell culture media, there was no detection of the virus. So even just simply washing in a domestic wash with cold water and no detergent, there was no detection of the virus. So this was around a 6-log reduction of the virus on textiles. However, when we looked in artificial saliva, there was a detection of 1.78 logs of the virus on cotton only when laundered domestically without detergent. However, when you looked at the addition of detergent and temperature, we were able to completely remove the virus from the textiles. So what this really highlights is that if you're following the guidelines of domestic laundering, it's removed from the textile. However, it just highlights the importance of the handling of the textiles before it go into the wash, as it is remaining stable over time on the textiles before it's laundered. So just to quickly summarise, we found that the model coronavirus survived for at least 6 hours on various textiles and was able to transfer from polyester onto plastic and to other polyester surfaces. And we found that it was remaining stable during laundering in artificial saliva without temperature and detergent, but using the addition of detergents and temperature actually removed the virus from the textiles. So thank you very much. I'm going to hand back to Katie now.
And as a team, what we felt was really important was we were okay looking at the science and the physical textiles here, but there was a person element to this. There was the nurses in the hospital having to wear those uniforms, having to take those uniforms home and having to launder them. And for me, this was just as important as understanding the science, because what was the knowledge, what was the risks to those individual healthcare workers? And this is when Lindsay joined the team as the psychologist, and we started to survey nurses and their behaviour and their attitudes and their feelings to actually having to do this on top of what was already a very stressful environment and the fear of the virus that was going on at the time. So via Nursing Times, Nursing Standards, the trade bodies, the NHS trusts, we developed a survey, and we had quite a large response to this in quite a short period of time. So this survey went out in 2020 at the first real peak. And then we did it again in 2021. But as you can see from the response rate, I think people's level of I wouldn't say fear, but wanting to understand the issue had gone down because there was so much more knowledge out there. So what this found was that 86% of participants were actually still laundering at home, despite the guidelines saying that where possible it should be industrially laundered. 71% were confident in that they felt they knew what the guidelines were. However, there was still 17% still washing below the recommended 60, which actually, from what we know from the science, wasn't necessarily an issue. However, we also looked at tax relief as well, because this was an added cost, and nearly 50% weren't aware that you could claim tax relief on the domestic laundering, and 47% were just not aware of that. 68% of people stated it would be safer and more appropriate for their employer to launder the uniforms, and over 50% felt an anxiety to having to take these uniforms home, and I think that's the really important part here. And as we've shown, the infection control risk from the point of leaving site to the washing machine. And I'm just going to hand over to Lindsay, who'll explain some of the behavioural work that she did around this.
So as part of the survey, we had an attitude component, and we utilised the COM-B model. This is a common psychological model when we're looking at social psychological factors that may influence the likelihood of someone to engage in a behaviour. So this is focused on someone's capability to enact the behaviour, their opportunity and their motivation. And so our survey was built around this. And what this particularly highlighted was, as Katie said, there's genuine worries over more than 50% felt concern or anxiety about home laundering. Just under a third also did not feel confident that they could carry out the laundering practices and reduce any potential risk to themselves or their family members with taking that uniform home. And this part of the survey was really highlighting, in particular, opportunity and motivation regarding this. Changing facilities were highlighted in this survey, again, through the free text comments and some of the items in the survey, that actually changing facilities are a significant barrier as well to how likely someone is to change their uniform at work and utilise the laundry facilities that may be available at work as well. So again, this could be an important element of this model if we were applying it and looking at those laundry practices and confidence in the future.